Hi everybody, welcome back. We'll get to another class. Today we're going to be working again with the one and only tennis ball, and carrying on from our video last time on looking after your back for the quadricep muscles here, thigh muscles, front of the leg. We're going to work now with the tennis ball to help us relieve a little bit of tension through the quadriceps muscles. Talked about before the quadricep muscles, 4 muscle groups, and in particular the rectus femoris muscle, which is lying on top of our underlying vastus muscle groups, medialis, lateralis, and intermedialis. So the reason I've chosen the quadricep muscles today with the tennis ball is that it can be very effective in 2 different ways to help you, as we talked about in our previous video about stretching for the quadriceps. There are 2 areas we can work on through our quadricep muscles, because the quadricep muscles will connect into different places, such as the knee joint and up into the hip. So this can have lots of different effects on your body. For example, with lower back pain, as I mentioned previously, it can come from tension in the front of the knee or restriction of movement through your muscles, which tilts your pelvis forward, which tightens the back up. So we can loosen off through here, through massage and stretching. That's one great thing we can do. Also with the knee down here, and with the rectus femoris muscle inserting into the knee joint around this patellar area, that may restrict your movement through the knee and even bring on a little bit of tension now and then. Especially, as I mentioned, if you're doing contact sports, a lot of overuse on the same action, such as running, soccer, netball. You're doing repetitive movements, which can put tension on your muscles through here. And if they're a little bit unbalanced, okay, they may be quite strong through running and walking and going to the gym, but they may not be balanced through flexibility and movement, which can bring pain or tension. So let's work on the knee joint first. And areas we can work on today are the front of the knee, under the joint here, under your knee joint here, the patella. You can get your tennis ball and just work in. So you'll feel a little bit of a groove underneath the knee joint here, a bit of a gap. You can put your tennis ball and just work in there, or even your fingers in there as well. It's like a little cap on top of your knee, which attaches the knee to the bottom of the leg and the top of the leg. So let's work in gently, some gentle massage around that knee joint or top of the knee joint, knee cap. And then you could use the ball as well to work in there. Any type of ball will be good. I know I use also a little spiky ball, which would be good for massage. You guys can use it as well. Tennis ball, golf ball, squash ball, whatever ball you got, something small that you can use in your hand. It's pretty good. So work for a couple of minutes around this knee joint. You may feel a little bit of tense pain in there. Just bear with it, and not to go too deep, but just gently roll around and see if that helps to relieve any tension. You may have had, this pain for a long time, so it may not go away straight away. It may take 3 or 4 times. So have a play around and just massage around there to see after 2 or 3 times of your self-massage, would that help relieve tension in that. And you'll know when you start walking, jogging, running again, after each self-massage session, does it feel better? If it gets worse, or maybe you need to think of something else and just back away from the massage for a little while, try a little more stretching, maybe a little bit of ice on there, some anti-inflammatories, and if it's really playing up with you, maybe go and see a health professional. But here's some simple tips that may release a bit of tension for you. Okay, so that's the knee patella joint around there we can work in. You can work on the inside of the knee as well. You can feel it's quite bony inside here. So you can just work with the tennis ball into the inside of the knee, the medial side of the knee. We have ligaments attaching into the side of the knee, which helps us to stabilize the knee. So sometimes they can get a bit rusty and crusty and a little bit tense. So we just want to see if we can get some freer movement through there by gentle massage. It's quite bony in there, so maybe you can use your fingers in there as well. Just a little bit of work in there. Feels quite good actually. It doesn't feel like a massage on my muscles, but I can feel that it's warming up bony area. Not such a sensation as when you're massaging on muscle, but it does feel warm and comfortable without being too excruciating. If it's a little bit of pain, I mean, just bear with it and just work within your own pain levels and not to exceed that and go too crazy too quickly. Give it a go. Okay, so we've done the patella, front of the knee, around the knee, side of the knee here, inside of the knee. Now we can work the top of the knee here as the rectus femoris muscle works into here and attaches into the top of the knee. That's where we get a little bit of tension too. So this one you can work a little bit deeper because you've got all the muscles around here to support you. Up and down. Well, it feels good. Yeah. Slightly different sensation. Now you're working into muscles, as well as maybe joints, ligaments. Comfortable sensation. You can even get your knee, you get your thumbs in there a little bit, just back and forth, just on top of the knee here, on the thigh now, above the knee cap, basically. For some of you, you may find that it is very, very tense in there, which is a good sign that you need to do a little bit of work in there to loosen off the tension. And that's the same with any massage on the thigh area. If you're massaging around and you're finding it's not sore or tense, maybe go to a point that is a little bit sore and tense, and that'll be worth more benefit to you than just massaging with no effect, to get better results and quicker. So I'm working again just above the kneecap. Feels good. It's not too tense for me, but it does feel like it is loosening off the muscles around there, which is really relieving and comfortable. It feels great. A little bit further, I've moved up another couple of inches into the middle area of the quadriceps now. So I'm getting into the rectus femoris proper now. And yeah, normally you'll feel a little bit of tension there, even if you don't do a lot of contact sports or vigorous running or working of the legs, but generally walking and moving around, our bigger muscles will feel more tension. So a general massage on yourself like this is going to go a long way to give you a bit more relief, and a bit of a release in your muscles. May help you with your tension in your back. Now I'm going a little bit higher, up into the thigh, nearly up to the hip. You might feel, yeah, that's a bit tense from all the running I've been doing, all the cycling, all the contact sports over the years. Yep, you need to work in there if you feel that it is a bit tense. Just back and forth. Get your tennis ball, have a rest, work it through like this. Okay. What we're doing here is getting the blood flow flowing through the areas that maybe haven't had a lot of blood flow through more recently. Break down the scar tissue if you had old injuries or tension through there over the years. Scar tissues generally just build up in the muscles, and it can be broken down over time, just that it hasn't been worked on. If you have an injury in the last 24 hours, maybe you've just been for your first run in 2 months, and you've pulled a muscle, such as your calf muscle or your hamstring's really tight, my advice is to do your rest ice compression elevation first for the first 2 days. But ice compression elevation to get the blood flow and the swelling down before you do this type of work. And then you can start this maybe in 3 days after your initial injury, soft tissue injury. But for general tension, this type of massage is fine. We're going to work now on the other quadricep muscles, the vastus group, inside, medial, lateral, and intermediate. So they're all underlying here. So we're just going to gently work through and a little bit into the groin muscle group. But wherever it feels a little bit tense, oh yeah, if it feels tense there, work in that area and concentrate on that area so you're not wasting your time. If it's not so tense there, okay, move to another area and work. Go to the outside, almost onto the IT, but not quite. The outside of the leg, work. So this is the IT band along here, so we don't want to work there today, but just inside of the, just before that, on the knee here, through the quadriceps, on the muscles, rather than on the band at the moment. We're just concentrating on the quadriceps and work through. So try, I'd say a couple of minutes on each area. The patella, kneecap, below the kneecap, around the top of the kneecap, outside of the leg, top of the kneecap here, through the rectus femoris muscle right through up to the top of the hip, inside of the leg, work through there too. So that's a good 10-minute, 15-minute massage. You got time, if not 5 minutes. In the morning, 5 minutes when you come home, it'll make the world of difference. There you go. A little bit of work for the knee, into the hip here as well. Help with your lower back pain, your knee pain, which may be affecting your back as well. So give us a go. You can. Take care wherever you are in the world during COVID. Love to hear from you on our website or email. You can catch me on anthonyfongfitness.co.nz. Yes, it is a bit cooler this morning, wearing my hat on to keep me warm. But love to talk to you again. Take care, and we'll see you next time. Hola.